Every person is unique. Their treatment prescription is individualized, and therefore the side effects they experience are also unique. For example, during my own chemotherapy treatments, I lost all the hair on my head, but I never lost my beard. My oncologist and I used to joke that my beard was a secret to my strength. Anyways, in this video, we're going to hear more from Doug and Shannon about the side effects they experience and how they communicated with their healthcare team about those side effects. We will also hear from an oncologist, nurse, and dietitian about what can be done to manage the common symptoms that people experience while on treatment. So let's get started.
So everyone's always quite concerned about side effects when they hear they're going to be taking chemotherapy. Our view is that all our side effects can be managed, and if they're not managed, we need you to call us because there's always more we can do. Not everyone will have the same side effects. Just as some people are car sick and others aren't, it's the same with chemotherapy.
Physically, my fatigue is still there. I still have to nap on a regular basis just to get through my days, and I just don't fight it anymore. It's just I have to do what I have to do to make sure my body is able to live. I've come to acceptance and understanding that this is where I'm at, and I'm okay with that, and I can still live an amazing life.
Fatigue is the most common side effect of being on chemotherapy, and it's not something that can be helped by more sleep. It's because of the effect of the chemotherapy on your blood counts. There is a video series available called Living Well with Cancer-Related Fatigue, so do check that out as it has lots of helpful advice. Nausea and vomiting is typically one of the side effects that people associate most with chemotherapy, but with the many drugs we can offer you, this should not become an issue for you. We don't want you being sick. Please do remember to take your anti-nausea medications as prescribed. Sometimes people decide to stop taking them because they feel fine, without realizing that it's because of the medications that you feel good. Please also bring your medications with you to your treatment. Hair loss is another side effect that people typically associate with chemotherapy. You will know if you're on a drug where hair loss might happen. You will get a lot more information in how to manage it and be directed to resources that will help you manage it. So constipation can be another side effect of chemotherapy, and really that's a variation from your normal. Fluids helps. It's very important to keep your hydration up to help prevent constipation. Mouth sores are quite a typical side effect of chemotherapy because that's one of the places where cells divide the fastest. One of the ways in preventing mouth sores is mouth hygiene, and there's a pamphlet available to you on instructions how to have very good mouth hygiene. If you do develop painful sores or white areas in your mouth or on your tongue, and it's affecting your swallowing or drinking, please do let us know. Nerve changes can happen with some drugs when you're on chemotherapy. You will know if you're taking one of these drugs. Diarrhea can be quite common on the day of your chemotherapy, just because you're getting substances that you're not used to in your body. But if it lasts for longer than 24 hours, again, please call us and let us know.
I had several side effects when I went through chemotherapy. I had hiccups, interestingly enough. I wasn't expecting that, but I had hiccups one morning. I had broke out in a rash. Woke up with a rash one morning that was a little bit itchy. But luckily I was at my cancer center every day, and there was people to ask about it, and they were able to very quickly prescribe me something to manage both those side effects.
You're given a lot of information, and we know it's hard for you to remember it all, but the three things I'd really like you to pay attention to are fever of 38 or above, drink lots and lots of fluids, and hand washing. Hand washing is still the best way to prevent infection. Do carry a hand sanitizer with you if it's not convenient to wash your hands.
Occasionally, fever is the first and only sign of infection, And if untreated, infections can be very serious in a person receiving chemotherapy. If you develop a fever, you should contact your oncologist or your healthcare team as soon as possible. It's important that you avoid medications like Tylenol and ibuprofen if you have a fever, because those medications can mask the fever.
So when you come for chemotherapy, your treatment nurse will go through in detail the side effects that are specific for your drugs.
With all the given side effects that potentially could happen for you, weight loss is definitely a risk factor, but we really discourage people from losing weight because it really impacts your ability to do daily chores and to feel good.
The side effects of chemotherapy can be very serious. Having said that, not all patients will experience side effects, and if you don't become ill, it doesn't mean that you're not still receiving the benefit of powerful treatment.
I think what really helped me through that was getting to know my clinic nurse, and she was really great, and my doctor, and feeling comfortable that though they're professionals and they have lots to do, that they are there to help support you, and that it's okay to tell them about your symptoms because that's what they're there to help you manage.
The side effects are different for everybody, so I would really encourage people to talk to their healthcare team when they meet with them and when they go to their cancer centers, and don't be afraid to open up and tell people that you're in pain today or you're in nausea today, because there's lots of people willing to help you and get you what you need to get through the journey.
Doug and Shannon both experienced side effects from their systemic treatments, but with the help of their healthcare team, they were managed effectively. You may experience some side effects like mouth sores, nausea, and hair loss, but also you might not. Everyone's systemic treatment side effects are different, and that's why it's important for you to communicate with your healthcare team. Make sure to keep them informed so that they can help you achieve the best possible quality of life during this difficult time. Well, that's it for this video. I'll see you soon.